I'm gonna talk about the best and the worst part of the entire experience. Bro. Hey guys, it's Mel. Merry Christmas. Today is Christmas Day. So I think the last time I talked to you was 2.5 weeks ago. I got too busy with moving and everything, so obviously now I'm in my new place and I noticed the scar looking like a lot better, and I really got excited and wanted to show you guys. Also, I wanted to update you on what the doctor said and everything. I took notes on that and I'll read that to you. So I asked her out of curiosity, who is the youngest person that she's ever had to give a bag to, and she said she had to give one to a 14-year-old, and it was a permanent one. I wish I wrote more about it, but I think that she had Crohn's or something similar to what I have, really bad, and I think she was diagnosed at like 3 or 4. She actually ended up dying like in college, and I'm like, holy fuck, like I feel like I hit the jackpot. She kept reiterating that yeah, I have Crohn's and it sucks, but I literally have like the best possible case of it. Like, it's so, I mean, I don't want to say mild, like I've been through a lot of shit. I had to get surgery for it, but it's not gonna kill me, you know what I'm saying? And it's in a spot that's treatable. It could just be so much worse, and I'm grateful that it's not. She said I didn't need to see her again, but she does want me to connect with another GI doctor here, so I'm gonna have to get a new doctor, and I'll probably just like tell them everything that happened and fill them in, but I don't think I'm gonna be getting any more procedures or anything like that. I think they just want to monitor me. She mentioned like a scar treatment that she could give me in the office. She said that that's like 6 to 12 months after the surgery, so who knows if I'll go back and see her and get it fixed up. But honestly, I think the scar is kind of badass, and now that it's like kind of healed, it's really not that bad. It's kind of whatever. I've been putting scar gel on it. Hopefully it'll just go away a little bit. I don't think there's a point in getting another operation done to fix it. Oh, and she said that I should start taking the Humira self-injections again 3 to 4 months after the last surgery. So maybe in like 2 months I can start taking Humira again, which I'm not looking forward to, but at least I'll be getting treatment. So anyway, dude, that's it. Those are all the questions that I have written down that she answered. So I think I want to make this the last video. I think this series needs to end. It's about to be 2022. I want to leave this in 2021. I'm going to show you the scars, and then I'm going to just talk about the overall experience, how I feel, and everything like that, just to wrap it up and give you a conclusion and end this series officially. And by the way, I dyed my hair and cut it, and I did it by myself mostly. I mean, I had a little bit of help at the end, but I did the same thing where I like put in a ponytail, cut it, whatever. I kind of forgot to mention that. You guys are probably like, what the fuck happened to you? So that's what happened. I'll show you my scars now, and then we can talk, okay? Trigger warning. This one, at least in my opinion, is not even that noticeable anymore. 1, 2, 3, 4, 5. I feel like it looks better. It's not so much indented anymore. Do you know what I mean? It's not really so textured anymore. Like, it's just a flat scar, pretty straight across. I think it looks a lot better and less gnarly, but it's so creepy touching it still because it's so hard. It's just like a line of hardness, just so much scar tissue down there. And I actually feel that on my other scars too. I think that all of the scar tissue is gone for these littler ones, but this one down here I still feel. And I think that one looks maybe the worst. I don't know. But anyway. Aw, you can see Rocky. Say hi. Hi, Rocky. I love you. This is the part where I talk about the experience, and that'll be it. And then my channel can go back to being fun, not so medical. Oh my god, I'm gonna lose so many subscribers from this series. It's gonna be so funny. Everyone's gonna be like, Mel, nobody fucking cares. Like, this is not what I signed up for. I guess we can put that to the test. I think I'm at 125 subscribers right now, so... well, right now, while I'm filming. So I think the worst part of this whole thing was not being able to lay on my stomach. From having a bag and having pain there and having like all the surgeries and shit. It's just been very sore and sensitive and uncomfortable. Even now, it still feels awkward. I feel very uneven when I lay on my stomach. Like, one side feels sore, one side feels okay. Like, it's just not comfy. So I really miss that because I used to love laying on my belly. Like, I would love to just like plop in bed on my stomach like boop, You know what I mean? Hopefully I'll be able to do that again soon. Like, I can, but it's just weird. I want it to not be weird anymore. I think that my favorite part of this whole experience has been getting used to all of the medically things, like IVs, blood work, being in a hospital, and whatever. I just know that if I ever have to do this again, it won't be as scary because I just got so used to it. Like, I've been through it all before. The next time I go get a shot or get blood work, I'm gonna be like, okay, whatever. Like, normally I would freak the hell out about that, but I don't know. I'm just so chill now. I'm just so grateful that I'm okay. I'm gonna cry. Oh my god. I'm just grateful that, like, I'm fine. You know? Like, I have a disease and it sucks, and I don't know anybody else who has this, and it's rare. Look it up. It'll say like 1 in however many thousand, and it'll list the condition as rare. But I'm just trying to appreciate what I have, and I'm trying to like change my mindset about everything and just be a more positive person. And I just look at everything that cancer patients go through, and like people who are dying young, and people who have to go to the hospital every so often to get like infusions and whatever the hell. I am happy that I feel like I have control over my life now. I feel like I have a clean slate. I feel like I'm healthy. My insides are all fixed. It's up to me to keep them that way. I think that that's sort of a cool responsibility to have. It'll force me to take care of myself even more than I normally would, because it's like taking care of a baby. Like, would you want to feed a baby like a bunch of candy if you really cared about it? Like, probably not. So I feel like I am finally caring about myself as much as I would Rocky. You know what I mean? Because he's my baby and I love him. I just think that that's an interesting concept, that if somebody has kids, they will love and care about their kids way more than they do themselves. And I don't like that. Like, I think that every person should value themselves just as much as they value the most valuable person in their life. So I value myself. I am grateful to be me. I'm gonna be happy, and I'm gonna work on some shit. I am going to come up with a diet that works for me, that's healthy in general and healthy for me and not dangerous, and I'm gonna try my best to not end up back in the hospital. But what's interesting is having the bag was not my least favorite part of the experience. It just didn't bother me. It was whatever. I kind of liked it. I'm so weird. Oh my god. Like, you literally, unless you've had one, well, actually that's not true. Even most people who have had them still can't relate to that sentence. So I guess 99.99% of the population will never have any idea what I'm talking about. But if you do, I think another favorite part of that experience was the nurses that I really liked. They were just so sweet. Creds to them. Like, they really be having these 12-hour shifts, freaking taking care of a million people. I feel like it probably takes so much out of them, but they remain calm and nice, and they do their job, you know? They don't complain. At least I don't think they do. I'm sure they do behind the scenes. So shout out to Bree, who's never gonna see this video, but she was my favorite nurse during my first surgery. I think she was my nurse for like 1 night during the second surgery. It really sucked because I expected her to be my nurse again the next night, but she wasn't. She was assigned to like somebody else. But she did pop in and say bye to me right before I left, and like, it was so sad. And she took off her mask, and she's so beautiful. I was like, girl, are you kidding me? It was so nice to like actually see her smile, and she was so genuine. Oh my god, this girl. Anyway, that was also good about the whole experience. Not having to work was nice. Not gonna lie. Oh, it's been so weird not talking to you guys and not having an outlet. I feel like you guys are just where I can... Do you know what I mean? Anyway, I gotta go, but I love you, and I'll see you in my next video. Thank you for everything. You guys are the best ever in the whole world. Subscribe to my channel, like my videos, and support me, and I will support you back spiritually and keep you in my heart forever. Okay, bye.